Assalamu alaikum. The article of this week is a quality assessment of randomized controlled trial reports in endodontics by Lucena et al., a Spanish and Brazilian group, and it was published in the International Endodontics Journal in 2016. We all know that the highest level of evidence for an intervention is obtained from the systematic review of a number of high-quality randomized controlled trials. However, a significant number of randomized controlled trials in endodontics have methodological flaws. These flaws can undermine the reliability of these trials. Therefore, evaluating the quality of RCTs is of high importance for a proper application of evidence-based dentistry approach. In this regard, an RCT report should describe in details with accuracy and transparency the design, implementation, analysis, and results of this trial. The CONSORT, which is Consolidated Standards of Reporting Trials statement, aims to guide investigators in conducting and reporting clinical trials in a standardized way. It was originally developed in 1996 by Pick et al. And was updated in 2010 by Mohr et al. Currently, an increasing number of dental journals have adhered to the CONSORT recommendations for publishing clinical trials. However, a number of studies that have assessed the quality of RCTs in dental research using the CONSORT checklist is still limited. Therefore, the aim of this study was to assess the quality of the reports on RCTs published in the field of endodontics between the years 1997 and 2012. To this effect, compliance was registered with the quality checklist based on the JADAD criteria, CONSORT guidelines, and SPIRIT recommendations. The study also aimed to investigate whether factors such as adherence to the CONSORT recommendations, number of authors, number of centers involved, and journal position in the Journal of Citation Reports ranking had an impact on the overall quality of the RCTs. In order to evaluate the RCTs, a checklist was developed by the three of the investigators associated with this study under a close supervision of the statistical advisor. The checklist contained 36 items that include all of the JADAD criteria and most of the CONSORT statement and SPIRIT recommendations. The items included in the checklist such as general information of the authors, ethical aspect, design of the study, assessment of the results, and clinical relevance of the study. And they also identify potential trial characteristics related to the quality of the report, such as number of the authors, number of the centers, compliance with the CONSORT guideline, and position of the journal. It was found that the 89 RCTs came from 21 countries and has been published in the 17 journals. The two journals of core endodontics profile, which was the Journal of Endodontics and International Endodontic Journals, accounted for 64% of the publications, which represent almost 60% compliance with the checklist, obtained significantly higher scores than the studies that did not. Trials signed by 5 authors or more were associated with increased quality scores, and also multi-center trials showed higher scores than single-center trials. RCTs published in journals of a higher impact and those above the median were found to be of a greater quality. Out of the 89 trials, only 11 articles claimed adherence to the Declaration of Helsinki. Although not all fulfilled their recommendations, only 2 of these 11 trials had a registration number in the World Medical Association. Regarding other ethical aspects, 11% of the reviewed articles did not record ethical committee approval and 5% did not refer to the informed consent. More than half of the articles used a method for subject allocation involving a high risk of bias or did not provide information on the randomization method used. The lack of description and high risk of bias for allocation concealment were found to be reaching up to 78%. Regarding the study design, the single-center trials were 77.5%. However, in 75% of the cases, framework description such as superiority and non-inferiority was not included in either the title or in the materials and methods section. This aspect is important because calculation of an ideal sample size and statistical analysis for testing superiority differs from those investigating non-inferiority. Almost 20% of the papers did not even mention whether blinding was used or not. 86.5% of the articles included did not offer measures of central tendency and dispersion. It has been not possible to determine whether the statistical methodology applied was appropriate or not. In 2% of the cases, the authors did not mention the statistical test that was used, and only 15% of the authors presented confidence intervals, while almost 25% failed to state the exact p-value. The present result suggests that those aspects of RCT's reports that are clearly suboptimal and therefore require improvement, efforts such as compliance with the consort guidelines should be made to minimize potential sources of bias and improve the quality reporting of RCTs in endodontics.